Dr. Thompson, what is the best prevention for a stroke? I mean, diet and lifestyle, is it as simple as that, like with heart attack?
Somewhat simple, somewhat
Okay.
somewhat complex. Diet and exercise or lifestyle are real big factors. Individuals who have high cholesterol, do not exercise regularly, have morbid obesity, are more likely to have, or at higher risk to have
They
stroke.
are.
Individuals who modify their diet and exercise and reduce those problems lower their risk for stroke. But some factors are really beyond our control. If you have a family history of cardiovascular disease, particularly of stroke, if you have a genetic profile, so to speak, that predisposes you to that, you can't change that.
Okay.
Every year we age after about 45, and the only alternative to aging isn't so good,
Okay.
increases our risk. But, and as we talked earlier, women have a higher incidence of stroke than men. But we can't change those things. But the things we can change are the lifestyle factors that we discussed. And to do that, you need to know some things. You need to know, as we've talked in other segments, about your family history. But you also personally need to know, what is your blood pressure?
Really?
If you don't go
Blood
get
pressure.
it checked, you're not going to know. And blood pressure is commonly referred to as the silent killer. And a lot of people can have astronomically high blood pressures and feel just fine, and will present in an emergency room with a massive stroke, and they may have had high blood pressure for many years and not known it. Or they were told about it and they didn't feel sick, so they didn't modify their lifestyle or make changes in their life, and including taking medication frequently to get their blood pressure down.
So that you don't feel sick when you have high blood
you
pressure.
frequently don't feel sick. You're lucky if you do, because then you'll be more likely to deal with it. So you need to know your blood pressure and get it down. You need to know your cholesterol and keep that down. And people who have diabetes and certain other diseases need to keep those things under control. And that'll all lower your risk of stroke. But there are no guarantees in life. Nobody gets out of life alive. The other issue in prevention for stroke is that if you get symptoms, get in and get checked immediately, because there are medications available that can dissolve the clots and other things that can be done. They can sometimes go into the brain with catheters and control bleeding sites and literally save those brain cells. And the more brain cells you save, the less damage you have on a permanent basis. So you need to prevent the event, but you also need to take action if you're having the event to prevent the damage.
Well, thanks for clearing that up for me.
Thank you, Raina.